Most people believe they would know if they were having a heart attack. The chest pain, the left arm going numb, the dramatic collapse you've seen in every movie and every television show since you were a child. That image is so deeply embedded in our minds that most people over 60 do something extraordinarily dangerous when a heart attack actually happens. They wait. They think, "This can't be a heart attack. My chest doesn't hurt. I just feel tired. My jaw is a little sore. My stomach is upset. I probably slept wrong. I'll see how I feel in the morning." And by morning, the damage is done. I have reviewed the histories of patients who came to me after a cardiac event, men and women who sat with symptoms for hours, sometimes days, before calling anyone. And almost every single one of them said the same thing. "I didn't think it was my heart." They were right that it didn't feel like the movies. They were wrong that it wasn't serious. My name is Dr. Emmanuel Osei. I'm a cardiovascular surgeon with over 2 decades in the operating room. And today I'm going to show you 5 warning signs that seniors mistake for something else every single day. Signs that are happening right now in people who have no idea their heart is in danger. Stay with me. This may be the most important video you watch this year. Before we get to the 5 signs, I need you to understand something fundamental about how heart attacks work after 60, because it's completely different from what most people expect. Here's what actually happens inside your body during a heart attack. A coronary artery, one of the vessels supplying blood to your heart muscle, becomes blocked, usually by a clot that forms on top of a vulnerable plaque that has been building for years. The blood supply to part of your heart muscle is cut off, and that muscle begins to die. Now, here's the part that changes everything after 60. In a younger person, that process is often dramatic. The blockage tends to be sudden and complete. The pain is intense and immediate. The body sounds every alarm at once. But in people over 60, particularly women, people with diabetes, and people who have had years of gradual arterial damage, the process is often slower. The blockage may be partial. The nerve pathways that transmit pain from the heart become less sensitive with age. The body's alarm system gets quieter. Doctors have a name for this: a silent myocardial infarction, a heart attack with no chest pain whatsoever. Studies suggest that as many as 45% of all heart attacks are silent or have symptoms so atypical that the person never recognizes what is happening. 45%. Nearly half of all heart attacks in this country go unrecognized at the time they occur. Many are only discovered weeks or months later during a routine ECG, when the doctor looks at the tracing and says, quietly, "It looks like you had a heart attack at some point." At some point. Not last week, not last month. At some point. The person had no idea. This is the conversation we need to have right now. Starting with the first sign. This is the one that gets dismissed more than any other, and it is one of the most consistent warning signs in the research on atypical heart attacks, particularly in women over 60. Not ordinary tiredness. Not the kind that comes from a busy day or a poor night of sleep. Something different. An exhaustion that feels wrong, that arrives suddenly without explanation, that doesn't respond to rest, that makes simple activities, walking to the kitchen, climbing a flight of stairs, carrying groceries, feel disproportionately difficult. Here's what's happening inside the body when this occurs. When the heart muscle is not receiving adequate blood flow, either during an active blockage or in the hours and days leading up to one, it begins to struggle. The heart has to work harder to compensate. The body diverts resources. Energy drops dramatically. The person feels profoundly tired without understanding why. A landmark study published in Circulation found that among women who had experienced a heart attack, 70% reported unusual fatigue in the weeks before the event. Not chest pain, not arm pain, fatigue. 70%. Weeks before. The warning was there. The body was signaling. But fatigue is so easy to explain away. Stress, poor sleep, getting older. I've been overdoing it. Here is what I want you to remember. If you experience fatigue that is qualitatively different from your normal tiredness, sudden, unexplained, disproportionate to what you've been doing, that deserves a medical conversation. Not tomorrow. Today. Tell your doctor specifically, "I've been experiencing unusual fatigue that feels different from my normal tiredness." Ask for an ECG and a troponin blood test. Troponin is a protein released by damaged heart muscle. It is one of the most sensitive markers we have for cardiac injury. This one stops people cold when I describe it, because it sounds completely unrelated to the heart. Jaw pain, neck tightness, upper back discomfort, an ache between the shoulder blades. How could that possibly be a heart attack? Here's the anatomy. The heart shares nerve pathways with the upper body. When the heart muscle is under stress, when it's being deprived of oxygen, pain signals travel along these shared pathways and are perceived in areas that have nothing to do with the heart itself. This is called referred pain. And in older adults, particularly women, it is far more common as the primary symptom of a cardiac event than classical chest pain. I have spoken with patients who went to the dentist 3 times in the weeks before a heart attack. They were convinced they had a tooth problem. The jaw pain kept coming back. The dentist found nothing wrong. It wasn't their teeth. Other patients described it as a stiff neck that wouldn't resolve. Upper back pain that they assumed was muscular. A tightness across the shoulders that came and went. The pattern that should alarm you is this: discomfort in the jaw, neck, or upper back that comes on with exertion and eases with rest. That is classic cardiac referred pain. It means the heart is not getting enough blood when it works hard, and it is telling you so through the only pathways available to it. Any unexplained jaw, neck, or upper back discomfort that comes on with physical activity and resolves with rest deserves a cardiac evaluation. Tell your doctor exactly when it happens and what makes it better or worse. That pattern is diagnostically critical. Most people associate shortness of breath with lung problems, asthma, COPD, anxiety, but unexplained breathlessness, particularly when it appears suddenly, gets worse with activity, or wakes you from sleep, is one of the most important cardiac warning signs in older adults. Here's why it happens. When the heart muscle is damaged or under severe stress, it becomes less efficient at pumping blood forward. Blood begins to back up. It pools in the vessels leading to the lungs. Fluid seeps into the lung tissue. The person feels short of breath. In a classic heart attack with severe chest pain, the breathlessness tends to accompany the other symptoms, and the connection is obvious. But in a silent or atypical event, breathlessness may be the only symptom, or it may appear days before any other sign. I want to tell you something specific about this sign in people over 60. Many older adults gradually reduce their activity level over months and years without realizing it. They stop climbing stairs. They take the elevator. They slow their walking pace. They avoid situations that make them breathless. And in doing so, they never notice that they have become significantly more breathless because they have unconsciously adjusted their lives to avoid triggering the symptom. A simple question worth asking yourself honestly: am I doing things today that I was not doing a year ago, specifically because they made me breathless? Have I been quietly accommodating a limitation without naming it? If the answer is yes, that is a conversation worth having with your doctor. Today, note when breathlessness occurs, how long it lasts, and whether it wakes you at night. Waking from sleep with breathlessness, called paroxysmal nocturnal dyspnea, is a particularly significant cardiac warning sign. Report it specifically. This is the sign that sends the most people to the wrong doctor. Nausea, a feeling of indigestion, discomfort in the upper abdomen, sometimes vomiting, sometimes a sensation that feels exactly like heartburn or a stomach ulcer. The person takes an antacid. They rest. They assume they ate something that disagreed with them. Sometimes they're right. Often, after 60, they're not. The lower surface of the heart, the inferior wall, sits directly above the diaphragm. When this area of the heart is deprived of oxygen during a cardiac event, the signals travel through the vagus nerve and are perceived as gastrointestinal symptoms: nausea, upper abdominal discomfort, the urge to vomit. In inferior wall heart attacks, gastrointestinal symptoms are so common that they are documented as the primary presentation in a significant proportion of cases. Here is the pattern that should concern you. Nausea or upper abdominal discomfort that comes on suddenly is accompanied by sweating, unusual tiredness, or any feeling that something is wrong, even if you can't name exactly what. Cardiac events often produce a non-specific sense of impending doom. Patients describe it as, "I just knew something was very wrong. I couldn't explain it, but I knew." Trust that feeling. If you experience sudden nausea or upper abdominal discomfort accompanied by any other symptom on this list, sweating, fatigue, breathlessness, jaw discomfort, do not reach for the antacid. Call for help. The combination of symptoms matters more than any single one. This last sign is the hardest to quantify and the most important to take seriously. A sudden cold sweat with no obvious cause, clammy skin, a feeling of lightheadedness that isn't explained by standing up too fast, and something more difficult to describe, a profound sense that something is wrong. Not anxiety, not worry about something specific, just a deep, visceral certainty that the body is in distress. Here's the physiology. When the heart is in serious trouble, the nervous system activates an emergency response. Adrenaline floods the system. Blood is redirected from the skin and extremities toward the vital organs. The skin becomes cold and clammy. The person may feel dizzy or lightheaded as blood pressure fluctuates. This response is the body's most primitive alarm. It has nothing to do with emotion. It is a physiological signal that something critical is happening. In study after study, patients who survive heart attacks without chest pain describe this feeling in remarkably consistent terms. Something felt wrong. They felt weak in a way they had never felt before. They had a cold sweat for no reason. They felt like they might pass out. And in many of those same studies, these patients waited. They told themselves it would pass. They didn't want to overreact. They didn't want to call an ambulance over something that might be nothing. Here is what I need you to hear. A cold sweat with no physical cause, accompanied by any sense that your body is in distress, is not nothing. It is your body doing everything it can to tell you that it needs help. Listen to it. If you experience a cold sweat combined with any other symptom from this list, call emergency services immediately. Do not drive yourself. Do not wait to see if it passes. Time is muscle. Every minute of delay in a cardiac event means more heart muscle lost permanently. The paramedics would rather come to you and find nothing than arrive too late. I want to tell you about a woman I'll call Dorothy, 71 years old, retired nurse, which makes what happened to her even more significant. She knew medicine. She had spent her career caring for others. For 3 days, Dorothy had been feeling unusually tired. Not sick exactly, just wrong. She noticed mild discomfort in her upper back that she attributed to sleeping in a different position. On the 3rd day, she felt nauseous after breakfast and had a brief cold sweat that lasted about 10 minutes and resolved. She almost didn't call anyone. She told herself she was overreacting. She told herself she was a retired nurse who had seen real emergencies, and this wasn't one of them. What made her call was one thing. The feeling that something was wrong would not leave her. She couldn't shake it. She called her daughter. Her daughter drove her to the emergency room. The ECG showed changes. The troponin came back elevated. Dorothy had been having a slow, partial blockage of her right coronary artery for 3 days. 3 days of warning signs she almost explained away. The interventional cardiologist placed a stent. Dorothy was discharged 2 days later. She made a full recovery. She told me afterwards something that has stayed with me ever since. She said, "I spent 30 years telling patients to trust their bodies. I almost didn't trust mine. The knowledge was there. The signs were there. The only thing that saved her was the one thing that can't be taught from a textbook. She listened." I want to say something directly before we close. The 5 signs we discussed today, unusual fatigue, jaw and neck discomfort, unexplained breathlessness, nausea and upper abdominal pain, cold sweats, and a sense that something is wrong. None of them are exotic. None of them require special equipment to notice. They require attention. And here is the most important thing I can tell you about all of them. The window between the first sign and serious permanent damage is often measured in hours. Not days, hours. Acting quickly is not overreacting. Calling for help is not weakness. Going to the emergency room and being told it was nothing is not embarrassing. It is the right decision every single time. You are not a passive observer of your own health. You are the only person who knows what normal feels like in your body. When something feels different, qualitatively different, not just tired in the usual way, but wrong in a new way, that difference is information. Trust it. Act on it. Do not wait until morning. The heart muscle that is preserved because you acted quickly is muscle that will keep you alive and active for years to come. That is not a small thing. That is everything. 5 warning signs of a silent heart attack that seniors mistake for something else every day. 1. Unusual fatigue, sudden, unexplained, disproportionate to activity. Not ordinary tiredness, something that feels qualitatively different. 2. Jaw, neck, or upper back discomfort, especially if it comes on with exertion and eases with rest. This is referred cardiac pain traveling through shared nerve pathways. 3. Unexplained breathlessness, particularly with activity or at night. Ask yourself honestly whether you have been quietly avoiding things that make you breathless. 4. Nausea, indigestion, or upper abdominal discomfort, especially when accompanied by sweating or a feeling that something is wrong. The inferior heart wall sits directly above the diaphragm. 5. Cold sweats and a sense of impending doom, the body's most primitive emergency response. If your body is telling you something is critically wrong, believe it. If 2 or more of these signs appear together, call for help immediately. Do not drive yourself. Do not wait. I want to hear from you. Have you or someone you love experienced any of these signs and dismissed them as something else? A stomach problem? A sore muscle? Just getting older? Tell me in the comments. I read every single one. And your story might be exactly what someone else needs to hear to recognize their own warning signs before it is too late. If this video gave you something important, please share it. Not for me, for someone in your life who believes they would know if they were having a heart attack. Someone who would wait. Someone who needs to hear this before they need to hear it. Send this to them. It costs you nothing. It could save everything. Everything I've shared today is based on current cardiovascular research and my clinical experience as a cardiovascular surgeon. This is general information, not personal medical advice. Always consult your own doctor before making any decisions about your health. Take care of your heart. It has been working for you every single minute of your life without ever asking for anything in return.